Dr. Karriem from Pain here again, and in this video we'll be discussing lumbar spinal stenosis. So lumbar spinal stenosis is characterized by a narrowing of the spinal canal. This narrowing can be as a result of a congenital abnormality or more commonly related to aging and degenerative change. With degenerative spinal stenosis or acquired spinal stenosis, the narrowing of the canal is predominantly caused by enlarged facet joints and thickening of one of the ligaments that run in the canal, called the ligamentum flavum. This in turn causes compression of nerve roots, which result in specific symptoms. The common symptoms of lumbar spinal stenosis are localized lower back pain and pain and discomfort in the legs. The discomfort or pain in the legs is typically exacerbated by walking or standing and is typically relieved with sitting. So what then is the treatment of lumbar spinal stenosis? We can divide it up into 4 options. So the first would be no treatment. So if there is no serious nerve compression or the patient is severely ill and cannot undergo general anesthesia. The second option would be treatment that doesn't require any specific intervention. This would include oral medication such as painkillers and anti-inflammatories, and then a combination of therapy which can include physiotherapy, occupational therapy, biokinetic therapy, or chiropractic therapy. This would be appropriate for patients with limited nerve compression and again for patients who cannot undergo general anesthesia and a more invasive treatment. The third option is limited intervention. So this would include minimally invasive pain procedures such as caudal and sacral blocks and pulse radiofrequency rhizotomies. The advantage of these procedures is that the risk of side effects and complications are low and it can be performed as a day case procedure. The last option then would be intervention such as surgery. The indications for surgery are failed conservative management as discussed in option 2 and 3, muscle weakness due to nerve compression, and a cauda equina syndrome, which was discussed in the video on slip discs. It is important to note that this condition usually follows a progressive course but can be treated non-surgically up to a certain point. If these symptoms sound familiar, feel free to contact a pain clinic near you. We are situated in Foreshore, Panorama, Simonstown, Paarl, Worcester, and Vredenburg. Stay tuned for more informative content.